Hello, good afternoon, and welcome to the Facebook Live edition of American Oncology Institute. I have with me Dr. Rajiv Srivastav, who's a senior radiation oncologist. And today we're going to have a discussion on radiation therapy for cancer during COVID-19. Sir, thank you so much for taking time and being with us this afternoon. Appreciate the trouble that you've taken for us.
Thank you. Good afternoon.
Right, sir. Sir, before we get into the COVID scenario, a lot of people do not generally also understand what is radiation therapy. There is general awareness of the term, but none of us really know what exactly radiation therapy means.
Generally, radiation therapy means treating cancer with ionizing radiation in general. But it can be treated with other type of radiation also, but most commonly we use X-rays. Other types like protons are also there. But whenever we are talking about radiation therapy, in general, it is X-ray. The difference between the normal X-ray and the X-ray therapy which is being used in radiation is we are using high energy X-rays which are penetrating deep inside and they are giving the effect of by killing the cells of the tumor.
Right. Sir, now what is about radiation therapy for cancer patient that makes it a lot of people have a lot of misinformation, or they are afraid of undergoing radiation therapy. Is there anything about radiation therapy that people should be afraid of?
Yeah, in my so many years of experience, I have also heard many myths among peoples. They fear about radiation therapy, and accordingly, I have heard that people have given a different terms about radiation therapy.
Right.
Like the electrical therapy, some say heat therapy, some say so many terms I have seen that are being loosely used, and accordingly it creates fear among normal persons, because when you say you have to take an electric therapy, they will think you are going to give a shock, or if you say you are talking about some heat therapy or something like that, or current therapy, then it is going to create some problem in the discomfort or some sort of problem. But actually, it is nothing. These all terms are being loosely used. Radiation therapy is simply use of high energy X-rays, which doesn't give any sensation. You don't have any sensation. It is just like normal X-rays. You go there, you don't have any feeling, you cannot see, you cannot feel anything. It is simple procedure, nothing to fear about it.
Right. Sir, are there any side effects, like people talk about losing their hair, or people talk about changes to their body complexion and so on, or their skin? Are there any such side effects that a cancer patient may have post radiation therapy?
See, the radiation therapy in simpler terms acts by acting on DNA of a cell. It breaks the DNA and thereby it gives its effect. Now, the question is which cells we are going to target. The problem is that the older generations, the previous days, whenever radiation therapy was used in a cobalt era, you can say, where it was not targeted. So the tumor was there and there was surrounding tissues, the normal tissues or normal cells, what we call. So whenever radiation therapy was delivered, it was equally affecting the tumor cells as well as normal cells, and thereby it was creating side effects. Nowadays, in a modern era, this radiation therapy has become a more or less a targeted therapy. We are targeting towards the tumor only. So when you protect your normal tissues from radiation, give lesser and lesser dose within their threshold to the normal tissue and deliver highest possible dose to the tumor tissue, you have a very less side effect. Now, coming to the specific about your query, the hair loss and all those. See, the radiation therapy is a localized therapy. It is never a systemic therapy like a chemotherapy where you inject drugs in the blood and it goes all over your body. It is a localized therapy. It acts where you are giving. It means the region where the tumor is there and its regional spread, so like the lymphatic chain in its vicinity. So wherever you are going to deliver radiation, it is going to affect only that place, no other side effects apart from it. And that too, if you go the with a modern era, newer machines, more targeted, lesser and lesser side effects.
Sure. So, in your experience as a radiation oncologist, what are some of the challenges that you face when you talk to cancer patients regarding putting them under radiation therapy as a treatment procedure?
The most important or the most common challenge we as a radiation oncologist face is the problem of information, or you can say the problem of misinformation. Because in our society, the radiation therapy is talked about something which is very destructive. Radiation means everybody thinks about atomic bomb, that you are going to drop some atomic bomb on a person and it is going to destroy everything. So that fear is in the mind of the person. So whenever a person starts interacting with us, the first question the patient asks is whether it is going to create any harm to me,
Right.
whether it is going to create some problem or disfigurement in my body. And some of the patient go to the extent that they say that after receiving radiotherapy, whether I am going to become radioactive and start emitting radiation. So these types of misinformation we always face. And the most important part is that radiation therapy being a most important pillar of cancer management, still among society, among peoples, it is still less understood. So that we always face, and our first interaction always tries to elevate all those misinformation and then tell the whole important aspects of radiation therapy, how it is being delivered.
Right. So now coming to COVID-19 now, of course, this phenomena has taken over the world, and everybody is thinking and talking about it. So is there any specific implication of the coronavirus on cancer patients and subsequently on those undergoing radiation therapy?
See, this COVID-19 or coronavirus has changed the entire world. The scenario has changed. The way we were living, the way what we were doing, interacting with the people, it has changed everything. But at the same time, the other problems, the treatment, the disease which was there, it is always there. It is in this background. So the cancer is always there. The problems are always there. And the treatment associated with cancer is always there in this background also. Now, as a oncologist, what we are doing is, it is worldwide, it has been recommended now that you have to see these patients in a different way so that there is a minimal exposure of these patients. And normally what we do, we prioritize the treatment. We see what is your priority for the treatment. There are some cancers which are very much curable and the chances of cure is very high, or there are some symptoms where you need immediate attention, immediate intervention is required. So those areas are called high priority areas. So normally we categorize patient into high priority, medium priority, low priority. Accordingly, in this scenario, we tell our patients who are the patients who has to immediately come to the center, who can wait for some time, or who can wait for more time. That way we are categorizing, and all those the norms of cleaning hand, mask, social distancing, these are always there. And at the same time, the hospital, the premises, and the area where radiation therapy is delivered, that is also being now geared up to tackle this situation.
Right. And sir, also these machines, they are non-invasive and non-contact, I would suppose. So it doesn't matter if multiple patients are treated with the same machine for radiation?
Yeah, the machine, normally what we use is a linear accelerator machine. The linear accelerator machine never comes in contact with the patient. But at the same time, the immobilization device which is being used, it comes in contact with the patient. Now these immobilization devices are made customized, means a one immobilization device for each patient. So each patient has their own immobilization device, custom made. Now, the second point is the couch on which they are lying down, the couch of the machine. So there are protocols now on place, the cleaning protocols. So after each and every patient, the cleaning happens. The person who is treating, the technologists, they are taking precautions. They are doing following each and every protocol for cleaning. The mask or immobilization device which is being used for these patients, they are also being disinfected every after every treatment for every patient. So that way, there is whatever precautions are to be needed to be taken, we are be taking that.
Right. So now, in terms of sometimes patients may think, is it really necessary for me to start or continue with my radiation schedule during these times? Because maybe I don't want to go to the hospital, or maybe it is difficult to go to the hospital. So, if you can answer this in two parts. One, for patients who may not have started radiation therapy but were planning to, does it now make sense for them to wait for this period to end and start? And secondly, patients who are already in radiation therapy, should they now take a break and come back once all of this COVID scenario is completed?
See, I will come to your first part of your question. Those patients who have not started their treatment. Now, as I have told you, that we categorize the cancer into three areas: high priority, medium priority, and low priority. So, accordingly, patients should consult their consultant and see what is their priority. If they are coming under high priority, they need to come immediately. If they are in medium priority, they can wait for some time, not long, but some time. Low priority areas can wait for considerable amount of time. So that is the first part, though for those patients who have not started treatment. But there are some patients who are already under treatment. So in those, normally it is ideal that you should complete your treatment, because whenever you break your treatment and its outcome gets compromised. So if you have already started, normally it is ideal that you should complete your treatment quickly. So accordingly, worldwide, the radiation bodies, the all those associations and worldwide bodies, peoples, they have come up with different recommendations. And to reduce the contact time of the patients, there are some hypofractionation schedules which are being now recommended. Hypofractionations means you are giving same treatment but in a lesser time. So you are shortening the amount of or duration of time to which patient will stay with you. Like suppose a treatment normally happens for 5 weeks, you can shorten it for 3 weeks, like that. So that way you are reducing the exposure.
Sure. So now, coming to the kind of technology and infrastructure that we have available at American Oncology Institute, we already know that we have the best cancer treatment facility in the country. But if you can elaborate on this aspect, the kind of infrastructure we have for radiation, that would be helpful for the audience.
I will answer this question in two parts. The first part, what is the common scenario? And the second part, how now the newer technology has changed it. The common scenario at most of the hospital is that there is a machine, there is a treatment planning system, a dedicated server under one roof, and you have to come, sit there, and deliver the treatment or plan the treatment, do every aspect there only. You cannot see from any other place. That is the usual story at most of the place. But now I will tell what has changed now. Now, the technology, what we are using is that our system is on clouds. It means you can log into the system from any place. So when you are able to log into the system from any place, you are able to monitor your patient, you can monitor your treatment sessions, everything from anywhere. So that is a flexibility. Second thing, we have a international tumor board, which is also live. So at a time, all our centers across India and abroad, including USA, they connect. They can discuss the patients, they can discuss their treatment management. So the management which should be done for the patient as per guidelines happens. That is the second aspect. And the third aspect is whenever we are doing any activity, our entire system is based on server, and that server is wide open. Wide open, it means that anybody in the system who has the access can open it. So whatever a person is doing or whatever a person is doing can be seen by other persons. So indirectly, it's an audit. A person is always under audit. So whatever you do, you cannot simply, you are not writing anything on your file or anything and just setting in your Almira. It's a wide open in today's world era of information technology. It is everything is open. So your treatment is international as per guidelines, wide open for audit. That makes it different. It's a fully transparent system.
Right. So now, what we have available in American Oncology Institute, if you can talk about some of the different machines as you were pointing out earlier, uh, that will be helpful for the viewers and contrast it with what else is available with the others.
I will tell you the technology which has changed. Like most of the hospital in previous days, they used to have the cobalt machine, which was a very simple form of radiotherapy emitting machine or radiation emitting machine, that is teletherapy. So these machines were simply giving you radiation through a simple controlled window, you can say a square or rectangle shaped window without any controls. So a conventional form of radiation was possible. Nowadays, the linear accelerator, the latest linear accelerator, different types of machine which are being installed, they are well equipped machine. These machines have different energies on board. You have a choice of energy as per your tumor depth or requirement. You have a choice of photon, electron. Then all these machines are also equipped with the imaging device. So you can image a patient or the tumor on board during treatment so that you are very well sure that you're targeting correctly for your tumor. And then there is an important aspect of motion management. There is a motion management system also in place. So those tumors who are moving can be taken care. You can gauge the respiration also. So that way, it is now a very, the thing has changed from the previous one and it is the latest technology.
Right. So now, for somebody who is undergoing radiation treatment, what are some of the precautions or guidelines if they should follow in their regular normal life? So, are there things that they should do or should not do if somebody is undergoing radiation therapy?
See, there are all some of the do's and don'ts for radiation therapy, and some are common and some are specific to the site. It depends on which site you are getting treatment because it is a local therapy. But most commonly, I will take one example so it will be very easy to understand. Like head and neck tumor. If you are undergoing a tumor for any treatment for any head and neck tumor, so the simple common guideline is that you have to maintain adequate nutrition. Nutrition is very important. But at the same time, you have to avoid spicy foods because it will aggravate your problems. because sometimes these, if you are taking any radiation inside your oral region, it causes mucositis. So if there is a mucositis and you are taking spicy food, it will aggravate. So you have to avoid spicy food, but at the same time maintain nutrition. Then those area you have to take the skin care, because normally newer radiation what we are delivering is skin sparing radiations. Still, your skin might become sensitive during radiation and it shows changes. So you have to take care of your skin. Then there are some other aspects, like if you are using concurrent chemotherapy as a radiosensitizer, then there will be some precautions needed, which is along with chemotherapy, so that your immunity is maintained. And as I have already told you, diet is most important.
Right. And sir, in terms of complexity, if you were to, I know you will have a bias with regard to radiation therapy, but if you were to do a comparative analysis of chemotherapy versus radiation therapy versus surgery, so what comparatively are the advantages, if any, of radiation therapy as compared to the other modes of cancer treatment?
First, I would like to tell you one thing which is very important. The cancer management is multimodality management. It is a combination of surgery, chemotherapy, radiotherapy. It's never a single modality or entity which is more important and other is less important. Everything is important because everything is needed in combination in different. Some need one, some need two, or some need all. Yes, if you go specific, there are some tumors where early disease is there, and like surgery is equally effective. The same result you can get with surgery, same result you can get after radiotherapy. There you can compare. In those, yes, radiotherapy has an advantage of organ preservation. It can preserve your organ because without losing your organ, you can undergo that treatment. But people should not get confused with it, because ultimately all three therapies are important and it should be used in combination. It should never be compared that this is important and that is not important.
Right, right. And sir, now talking about the patient psychology, usually when somebody undergoes radiation therapy, is there a possibility that after remission or after the treatment, there can be a relapse of the same cancer in the same region?
Yes, cancer can relapse at the same site or nearby or at distance place also. That's why each and every patient who completes treatment, they are kept on follow-up and their surveillance is being done with different modalities. We do radiological tests, some other tests are there. We keep on doing at a frequent interval. So relapse can happen at same place also. It can happen nearby or it can be distant also.
Right. Sir, I think I'm good with my questions. I think I have a much better understanding of radiation therapy as a treatment for cancer during COVID as well as in normal times. I'm certain that our audience will be benefited by this conversation. I want to thank the audience who will watch this broadcast at some point. I want to thank the doctor for taking his time and joining with us. Until next time, from everyone here at American Oncology Institute, I would like to remind you that we are available on video consultations. Should you need any assistance, any advice, even during COVID times, you can visit our website and book yourself an online consultation, a virtual consultation with the doctor of your choice. American Oncology, as I pointed earlier, is one of India's best known cancer treatment facilities. You can know more about it on our website. We have 14 centers across the country, and we are the only cancer treatment facility rather, in the country to be associated with the International Tumor Board. So, for your company this afternoon, for Dr. Rajiv for his insights, once again, thank you very much. Until next time, from all of us, it's thank you and goodbye.
Thank you. Bye.